Good day, class. In this video, we are going to talk about the dizziness. Dizziness or vertigo, these two terms are actually different, but in the study we put them together. The reason is because there's the dizziness or vertigo from acupuncture point of view or from our treatment, they are quite similar. Very similar to the headache. There are also many different diseases that may result in vertigo or dizziness. So in our practice, when we see a patient present with vertigo or dizziness, we need to exclude some common diseases. Especially in the acute stage, we need to exclude some diseases that are related to the brain, hypertension, low blood sugar, diabetes, or some patients such as kidney failure. Heart failure, these severe diseases, sometimes we need to exclude. Apart from these, anemia, patient also may present as vertigo. Another very common cause from vertigo is also if the vertigo is related to posture. So if the patient tells you that the vertigo only happens when the posture change, for example, while lying down to seated, or from sitting to stand up, or turning the head, and then in this situation, you also need to exclude BPPV. So from the posture, in these diseases we don't, from acupuncture we cannot help. So if you suspect that this patient suffers from BPPV, you need to send the patient to the specialist in ENT. In a severe condition, the patient may feel like the spinning around them, but in a mild situation, the patient may only feel the kind of dizzy, or while they are walking, they feel that the floor is not solid. So it's the kind of feeling that they walk on cotton. Those kinds of sensation. And some patients, they even could not stand up. And other diseases that are related to the eyes also may result in vertigo. From acupuncture, from Chinese medicine point of view, we're still going to discuss from the theory. The etiology. From Chinese medicine point of view, vertigo, the location is in the brain. So something is affecting the brain's function. It's related to emotion, the diet, overexertion, and also the body constitution. So the qi and blood conditions is actually refers to the body constitution. The brain, or in the head, that's the top part of the body. In the top part of the body, the qi, the clear qi need to goes up to the top part of the body, or the yang qi need to goes to the upper part of the body. So anything that may result or may object the yang qi moving outwards to the brain, it will result in a deficiency in the brain of yang qi. Also may result in a blood deficiency. So in this situation, it will cause malnourishment in the brain and then result in dizziness or vertigo. And what may cause the lack of nourishment? It may due to the fire or the heat, especially the internal heat, the internal fire. That's from the emotion. The emotion, the qi stagnation may result in internal fire. Once the fire moves up, it will block the pathway. It also may reduce the yang qi in the body because the space is limited. The second is the phlegm blockage. If phlegm block in the brain or in the meridian, it may result in the lack of yang qi and blood in the brain. It also may result in vertigo. For phlegm blockage, we will focus on the spleen and the phlegm itself. Kidney axons and qi and blood deficiency, these are either the kidney or the spleen. Kidney axons deficiency, the overexertion, may from overwork, also may from the sexual activities. So these are some possible causes for the vertigo. The symptom differentiation. The main symptoms the patient may present as dizziness or vertigo with or without blurred vision. May accompanied by nausea, vomiting, tinnitus, deafness, sweating, pale facial complexion, etc. If the patient presents with dizziness, severe sweating, you need to check the blood sugar. That's the first thing you need to do to check the blood sugar. If a patient presents as nausea or especially if the patient presents as vomiting, with headache, dizziness, and some fundamental vital signs we need to manage or we need to monitor, such as the blood pressure, blood sugar, especially if patient presents as vomiting and headache. A few subtypes. The hyperactive yang, the hyperactive yang actually more related to the hyperactive liver yang. Dizziness, tinnitus, distending feeling in the eyes and the ears. The distending feeling is from the yang. Yang is kind of heat, especially hyperactive yang, abnormal yang in the head. That's a kind of heat. That's why the patient may present as distending feeling. Irritation, back temper, these are may related to the liver. Insomnia, dream, disturbed sleeping, that's from the emotion. Red facial complexion, red eyes, bitter taste, these are all heat. Red tongue, yellow coating, so these are all heat manifestations. Due to phlegm, the patient still, the main symptoms must be dizziness or vertigo. The patient may present as heaviness sensation, chest tightness, nausea, vomiting. If the phlegm stay in the middle jaw, the patient may present as nausea or vomiting. Poor appetite. Pale tongue with a white greasy coating, watery slippery pulse. As you can see, these manifestations, because the phlegm is a kind of an in pathogen. Phlegm and dampness are very similar. Phlegm is more sticky, so the patient will present as a heavy sensation. It's very similar to the dampness. Due to qi and blood deficiency, the patient may present as symptoms that are related to the qi deficiency and blood deficiency, such as pale complexion, fatigue, poor appetite. Due to blood deficiency, still the pale complexion, the pale tongue, faint white coating, and blurred vision. Due to deficiency, there's no enough blood supply to the eyes. Due to the liver and kidney insufficiency, the patient may present as dizziness, poor vision related to the liver, related to the eye. The patient also may present as fatigue, tinnitus related to the kidney. Dry mouth because of the yin deficiency with deficiency heat. Weakness and in the waist and knees. That's a very typical symptom in the kidney. The treatment principles will vary from different symptoms. The hyperactive yang, you're going to reduce the hyperactive yang. We use acupuncture with reducing technique due to phlegm, clearing the phlegm, tonifying the spleen, dispelling the dampness. Because the phlegm is from the spleen. Phlegm and dampness, these two are always together because phlegm is also in the category of dampness. We can use a combination of acupuncture and moxibustion because moxibustion can create the heat, can clear or dispel the dampness. Due to qi and blood deficiency, we're going to tonify the qi and blood. We can use combination of acupuncture and moxibustion, reinforcing a technique. Kidney and liver yin deficiency. Nourish the kidney and liver yin. Focus on acupuncture. Because the yin deficiency will accompany or may accompany with deficiency heat. So in this situation, we don't use moxibustion. The main points, we can focus on the local points and the foot Shaoyang meridian. U20, GB20, stomach 8, HM5, gallbladder 39. Because of the vertigo, something spinning, something moving, so this is something related to the wind. That's why we can use GB20. Due to hyperactive yang, we can add level 2, level 3 to clear the heat. We can tonify the kidney 3. Due to the phlegm, we can use pericardium 6, room 12, stomach 40. Stomach 40 again for phlegm. Room 12 can tonify the organs. Due to qi and blood deficiency, we can use room 6, spleen 10, stomach 36. Due to the liver and kidney yin deficiency, blood 18, blood 23, kidney 3. Because this is the yin deficiency of the deficiency of the organs, we can use the backshu points as well as the yuan source points. Similar to headache, the insertion of GB20 we need to be careful. In the severe condition, we can apply the treatment twice a day, 30 minutes to 1 hour each time. For vertigo, we also can use 3-edge needle technique, auricular acupuncture, or skull acupuncture. In the meantime, we also need to advise the patient from the diet to avoid greasy food, alcohol, or spicy food, etc. The treatment for the dizziness or the vertigo, it is very important that we need to identify the cause. Another cause is the lack of blood circulation, also very common in vertigo. And it's some other diseases, such as the dislocation of the cervical vertebra, also may result in dizziness. When we identify a syndrome, we can gather the evidence from the 4 diagnostic methods: inquiry, listening and smelling, observation or inspection, pulse diagnosis. From this diagnostic technique, we need to gather the information. For example, we can find the manifestations from the inquiry or the tongue diagnosis, but in the meantime, if you diagnose the patient due to hyperactive liver yang, or due to liver fire, or due to kidney deficiency, Once you identify these syndrome, it is also very important for us to find the cause for these syndrome or the possible causes as a result in these syndrome. These can be either from the diet, the lifestyle, or body constitution. For each single case, we need to identify all these aspects from the causes, from the pathogenesis, the syndrome, and the treatment principle, and then the treatment. In this video, we mainly discuss dizziness. When we see patients who are present with dizziness, it is very important for us to identify the potential or possible causes, especially the causes that are related to the ear or even the eyes, and sometimes they're related to the cervical vertebra. So these are, apart from relieving the dizziness itself, sometimes it is also very important to assess the potential causes, especially from the cervical vertebra. If it is affecting the blood circulation, we can use acupuncture such as GB20, Q15 to enhance the blood circulation. So these techniques we have introduced in our practicals. Thank you for your attention.